Hi, this is Dr. Michael Rothman, and in this video I want to talk to you about systemic candidiasis, also known as yeast or yeast syndrome. Now, many people are experiencing problems where they have chronic yeast infections, especially women, but this can happen in men as well, where you have this problem whether you may have vaginal yeast, oral thrush, skin rashes, toenail fungus, jock itch. These are all signs of a candida infection on your mucous membranes. Now, a lot of people are under the false impression that this is just an infection, and if they simply take an antifungal, all their problems will go away. And that may be the case in certain situations, but if you're suffering from candidiasis and you have a lot of other symptoms as well, for example, headaches, body aches, brain fog, fatigue, hormonal imbalances, gastrointestinal symptoms, it probably means that there's other things going on besides just the yeast infection. So you can take all the antifungals in the world, go on all sorts of cleansing diets, and your symptoms remain. And you say, what's going on? Why am I not getting better? And here's the key. If you have yeast infections or chronic candidiasis, this is a symptom of a bigger problem. And what is that bigger problem? The bigger problem is that your body's been dysregulated. Your immune system is not working properly. Your hormones are not working properly. It's a systemic problem which is manifesting in many ways with all these symptoms. It's also manifesting as systemic yeast and systemic candidiasis. So in order to fix this, if you do have this whole syndrome, is you need to fix what's wrong. And so people that have this often are suffering from what's called chronic inflammatory response syndrome, where they're being exposed to some sort of immune system stimulation, which is then weakening their system overall. And the most common cause of this is actually mold exposure, living in a water-damaged building, and the contents of that building sets off your immune system, which causes an inflammatory response, which then dysregulates your system, which then manifests as all these different symptoms, which include candidal infections and yeast infections. So the treatment must be holistic. It must take into account many factors: your diet, your hormones, your environment, your immune system, your nervous system. I have a lot of experience with this. If you've tried antifungals before and they haven't worked, if you've tried cleanses or other types of interventions, if you've been on yeast-free diets and they haven't worked, there's a good chance that you are suffering from chronic inflammatory response syndrome, and that this is just a symptom of this overall syndrome. So do not give up hope. This is not all in your head. There's many things that can be done for this. I hope this video was helpful to you. Have a great day.